Let's talk patients declining necessary dental treatment. I saw a patient yesterday, and a little bit of backstory to this patient is she's a patient in her late 70s. She has advanced periodontal disease, so she's got BPs of 40 to 50% bone loss and very heavy subgingival tartar deposits. I've seen this patient once before, and I vividly remember her standing up in the middle of the treatment and declining to continue with the appointment. She said that it was very painful, and every other hygiene appointment she's had before this, they never went below the gum. So this really confused me, and I was like, how do they not go below the gum? Because you have severe gum disease. Now, I pulled up the x-rays and I showed her the bone loss, I showed her the subgingival deposits, and explained why it was so important to be doing a deep clean and doing root surface debridement, and obviously referring her on to see a periodontist. Now, I saw her again 7 months later yesterday, and she said, I'm going to repeat it, do not go below my gums. I don't want any deep cleaning at all. Since seeing you, I've had 2 broken teeth, and they're because of the deep cleaning. So obviously I'm not there to argue with my patients. It's just not going to work, especially if they're already getting like quite distressed and upset. I'm just going to leave it. So I had a look at the notes, and these teeth were broken before that. I mean, I know that deep cleaning in that sense wouldn't have broken her teeth, because I had a look at the teeth and they were literally like the buccal wall standing and the rest of the tooth had gone. However, she had then declined treatment. So she said, I only want a gentle scale. So that's exactly what I had to do. I reiterated the importance of why I needed to go below the gum, removing the tartar, doing full mouth pocket probing depth. She wouldn't even allow me to do that. So I had to literally document all of this in my notes, what I'd recommended, what she'd said, what she'd declined, and the importance of it, and how I'd explain that to her. Now, I just think it's really difficult as clinicians when we're in this situation, because you can't argue with the patient. That's the last thing we want to do. But all you can do is kind of explain why and what the importance of it is. But if they ultimately still decline treatment, then we're left in a position where we feel like we're not delivering a good standard of care, but then we're also, I guess, regaining trust in the patient because we're doing what they want us to do. So I think what I can take away from that experience is document everything in the notes, and get your nurse to kind of like write up the conversations that you're having as you're having them, because you don't want it to be like back to the patient typing away. And we've had it before, haven't we? We've all had it where we've recommended a patient to have a filling and they've declined it, and then they come back 3 months later and they're in absolute agony, and then the treatment that you originally proposed is no longer doable. But I just thought I would discuss that with you guys, because I know that everyone will have experienced it. And if you have experienced something similar, then how did you deal with it? What was your approach to it? Because I do feel like we can all learn from each other in this situation. So if you were in my shoes yesterday, how would you have dealt with the appointment?